So there are a number of treatments for male enhancement. We have our non-surgical approaches like dermal fillers. We also have PRP or PRF to the penile shaft, and our Z-wave procedures. The PRP and the Z-wave are really intended to build more blood supply to the penis. So for someone who has more erectile dysfunction, where they're not able to form as strong an erection or sustain it for as long, then our blood enhancing procedures like PRP and our acoustic shockwave Z-wave procedures are going to be our go-to. You can certainly combine these together. So if you wanted more girth with the dermal fillers and combining that with our blood flow enhancing procedures, those are easily combined together. On the other side, where we have more of our surgical procedures, such as our fat transfer to the penis and the ligament resection, those are very commonly combined in the same procedure, so we can add both girth and length to the penile shaft. At the same time, if that patient also has some problems with erectile dysfunction, you can still add PRP to the procedure to add more blood flow, so the quality of the erection and the sustainability of the erection is maintained and improved. How do dermal fillers work for male enhancement? Dermal fillers for male enhancement of the penis is very similar in procedures as we do for the face, in terms of we use products, hyaluronic acids, to augment features of the face, like the cheeks, the chin, the lips, the folds, etc. We use the same products to also enhance the male shaft of the penis. The number of syringes that we use really depends on the goals that we're trying to achieve. It is done as an office-based procedure. We apply a little bit of topical numbing, and then we go ahead and do the procedure. So most patients will just opt to drive themselves here, have the procedure, and drive themselves home. In addition, you can be fairly active as soon as the procedure is done. So you may encounter a little bit of swelling, but once the swelling goes down, you can be as sexually active as you desire. When it comes to the non-surgical, if someone is coming in with erectile dysfunction, meaning they don't have good blood flow to the penis during an erection, then procedures like PRP and the acoustic shock wave, which stimulates more blood flow to the penis, can make a tangible difference. So going from more of a semi-erect to an erect position, you will notice some improvement both in length and girth. When it comes to someone who has a good erection, who wants to add more girth, and we're doing this non-surgically with dermal fillers, the size difference really depends on what your preference is and the number of syringes that it takes to get to your end goal. We add 4 syringes, you're going to notice a moderate degree of change. If we add an additional 4 to 5 syringes, you're going to continue to see more and more. And you can really determine your end point depending on what your budget is and what your goals are for your male enhancement procedure. How does fat transfer for male enhancement work? Fat transfer for the male penis is a surgical procedure, and it can be done under local or general or something in between as far as anesthesia goes. In terms of the actual procedure, we borrow a little bit of fat from one part of the body. Most commonly it's the abdomen. You don't really need to borrow a whole lot of volume since the penis is a fairly small organ. So we borrow enough fat, we process the fat, and then we're injecting it around the shaft of the penis. There's a limit to how much fat we can add in one session, but it is typically a very noticeable difference from a before and after standpoint. You can always repeat the procedure in about 3 months' time if you want to further build upon what we did with the first session. In terms of recovery, you do want to avoid sexual activity for a good several weeks, maybe upwards of 6, to allow all the swelling and discomfort to go down, and make sure that the fat is well incorporated before you use that enhanced penis. how much of the fat is actually retained. So typically, we say anywhere from about half to 3/4 of the fat will survive. And in order for fat grafts to survive, they have to be surrounded by healthy tissue. And that's what determines the limits as to how much fat we can add in one given session. With each subsequent session, if we do a multi-stage procedure, we can add more and more fat because we're creating an environment for more fat to be added, because whatever survives becomes part of your penile shaft. So again, typically it's about half to 3/4 of the fat survives, or you could say on average about 2/3. If I gain weight, will it affect my fat grafting results to the penis? In general, whatever fat survives after a fat grafting procedure, whether it's to the penis or to other parts of the body, that fat becomes living tissue in that new region where it was injected. So with respect to the penis, if you add fat there and you were to gain weight or gain body fat, your penile fat will also expand. Likewise, if you're to lose weight after the procedure, you may feel like your fat grafts have either gone away or reduced in its efficacy. Those fat cells are going to behave like normal fat cells. In response to excessive energy, it's going to store more fat. In demands for more energy, it's going to release some of those fat stores. So it is living tissue. So for a stable result, if your weight is fairly stable and your body fat composition is pretty stable, then your results will be very stable as well. So common question is, how does ligament resection or transection of the penile shaft work? To help with penile enhancement, we can either focus on girth, meaning making it wider or thicker, or with length. And with length, there's a ligament that holds the penis up against the abdominal wall. And if we were to transect that ligament that's holding the penis up, it allows the penis to expand outwards, and it won't be as erect and pointing upwards anymore, but it'll now point more forwards and have a little extra length. It can be anywhere from 1/2 inch to upwards of 1 inch, depending on how strong that ligament is in retaining and holding that penile shaft close to the abdominal wall. When we resect that, you can still have full function of the penis. It's just aesthetically, it's not going to be as upward pointing, and it's going to be more horizontal or even slightly downward. So how much larger can you get with male enhancement surgery? So in terms of ligament release, which is geared towards extending the length of the penis, you can comfortably get anywhere from 1/2 inch to about 1 inch in terms of length. As far as girth goes, we can certainly expand the diameter or the girth of the penile shaft with procedures like fat grafting. If you like what you see after one stage, we can certainly repeat it to further expand on the girth. The main challenge that you're going to find is the quality of the girth. The more fat we add, the more soft it may feel on the outside. So you want to maintain that delicate balance between an erection that is formed by filling with blood and how much padding around that firm erection that you want to place. But you can normally see substantial improvements, and a lot of that's going to be a personal decision that we discuss together and what we can do technically. So I often get the question, how often do I need to repeat something to be able to see the results that I'm looking for? And a lot of that will depend on the type of procedure that we're doing. If we're doing things for erectile dysfunction, such as the P-shot, which uses your own blood to re-inject platelets back into the penile shaft, or our acoustic shockwave procedure, which also stimulates more blood flow to the penile shaft, you typically only need to do a session of Z-waves or a single P-shot procedure before you can start to see changes. However, our penis, just like the rest of our body, continues to age, And over time, the signs and effects of aging will continue to occur in the penis just like the rest of our face and body. More commonly, we're repeating this procedure more like on an annual basis. In terms of our dermal filler procedures to improve the girth of the penile shaft, this is going to be more of a relative situation. The fillers themselves may last upwards of a year, and depending on how much we've added, you may even see the results extend beyond a year's time, but it's not like it's all of a sudden stable and then it goes down. It's gradually losing volume over time. So you can decide whether it's at 6 months, you're replenishing a little bit of volume, whether you're waiting at a year and you're going to be replenishing more of that volume, or if you certainly wait beyond a year, it's almost like we might be starting again from baseline. For surgical procedures, when you release the ligament to improve the length of the penile shaft, that's a permanent procedure. There is no need to repeat that procedure. Fat grafting to the penile shaft, that is something where you may lose a little bit more volume or potential blood flow to the penis with time. So you may need to repeat that, but in general, when you achieve the desired girth with respect to fat grafting, that fat is yours to keep and survives for a very, very long time. So the surgical procedures tend to be longer lasting. The non-surgical procedures you tend to need to repeat to maintain over time. So when it comes to contraindications or reasons why you shouldn't do male enhancement procedures are the following. If you're unable to form an erection altogether, and it could be something either physical because of nerve damage or mental is a good component to our ability to engage in sexual activity, then these physical changing procedures may not make a difference. If you're unable to form an erection for whatever reason, that needs to be worked out separately. In addition, if you have other medical conditions that may induce bruising, such as you may have really thin blood, you may have certain coagulation disorders that prevent you from forming clots, those are things for any procedure that involves needles or scalpel or anything needs to be discussed with your physician before you engage in these kinds of procedures. The third is we have certain procedures that stimulate blood flow. So you need to be able to have a wound healing response. And you also need to have platelets if we're doing procedures like the P-shot that are functional and abundant. If you have a platelet disorder, those procedures may not be right for you as well. Lastly, if you've had previous trauma to the penile region, that is certainly something to discuss with your surgeon before you engage in any of these procedures, because there may be altered anatomy, there may be increasing your risk factors, or it may limit the success of your procedure as well. When you come talk with me, I'll discuss these with you and we can discuss these contraindications in a more detailed fashion. The risks from male enhancement surgery is fairly minimal. You do want to make sure that you do not put pressure on the penis after fat grafting. These are living tissues. You don't want to be a stomach sleeper afterwards. You want to sleep on your back for the first several weeks. In addition, you do have the possibility that not all the fat survives. So if it's over-injected and we try to be too ambitious, you may be more at risk of developing little fat necrosis or fat that doesn't survive and liquefies in the penis. So we want to be very conservative with how much we put in with each session. The ligament resection procedure is also fairly safe. You are going to lose your ability to sustain more of an upward pointing erection, and it's going to be more horizontal or even slightly downward pointing in its appearance. Functionally, everything works really well. A lot of the main things with the surgical approach is you have more of a downtime than with the non-surgical approach, and that's both to help mitigate against swelling and potential for bruising, and just allowing for all the fat grafts and ligament resection to heal before you engage in sexual activity. On the non-surgical side, our male enhancement procedures include things like our Z-wave, which is an acoustic shockwave procedure to stimulate blood flow to the penis. We have our PRP and PRF procedures, which are also geared towards adding more blood flow to the penis. And we also have our dermal fillers. With each of these procedures, the relative discomfort is fairly low, both in terms of receiving the treatment or during the treatment, as well as the recovery. Typically, with recovery, you can be sexually active that same day or the following day. You may have a little bit of bruising when the PRP or PRF is conducted or with the dermal fillers, but that shouldn't preclude you from being active if you choose to do so. As far as our surgical procedures with fat grafting or the ligament release, those are real surgical procedures. You're definitely going to have and experience more swelling and potential bruising, and that may linger for a good couple weeks. The amount of discomfort that you experience may be a little tender, both in terms of where we borrow fat from and into the penile shaft. You may need some medications to help mitigate against the discomfort, but those are usually for the first few days, and then the discomfort usually subsides soon thereafter. As far as being sexually active, you may need to wait for several more weeks to allow for everything to heal, and especially with the ligament release, there's a little incision, and you want that incision to fully heal before you go back into really active activities like exercise or sexual activity. Typically, for our non-surgical procedures for male enhancement, one drives themselves to the office and one drives themselves home. For our surgical procedures, which includes fat grafting and ligament release, the choice is really yours. If you'd like to drive on your own, then we would be doing everything under pure local anesthesia, so we don't put the brain or the mind under the influence of medications. If you do have a driver, then we can give you the option of taking something oral, like a Valium, just to help take the edge off things. Or we can even give you the option of IV sedation, where you're kind of in a twilight zone in terms of where you really may know what's going on, but you don't care. And you don't really remember much about the procedure afterwards as well. Or you can even choose to be completely knocked out so you wake up and it's done. So the degree of sedation is really going to be a personal preference. But if you wanted the option of coming to the procedure and going home from the procedure on your own, that is possible. On the non-surgical side, if we're using dermal fillers to enhance the girth of the penis, you can expect to see results instantly. You may have swelling for a few days that may change the appearance slightly or temporarily, but after a few days, the results are fairly obvious in terms of the improvement in girth. When it comes to blood flow enhancing procedures like our P-shot or PRP or PRF to the penis, or using our Z-wave procedure, which uses acoustic shockwave to the penile shaft to improve blood flow, these take several weeks. It's more of a biological process, so don't expect something to happen overnight. When it comes to our surgical procedures, the ligament release is fairly instant, but you are going to have some swelling, and you may or may not have erections after the procedure. So you may not be able to fully tell the extent of the results until you become more sexually active. In terms of fat grafting, that's where you will see quite a bit of change initially. Some of that is swelling, some of it is the added volume that we've added. You'll probably need to wait a good several weeks for the swelling to fully settle down, and then a few weeks more to help see what fat has taken and what fat needs to be resorbed, the ones that didn't survive. So that takes several more weeks for that process to happen. Anywhere from a couple days to several weeks before you really can see the difference, depending on the type of procedure you decide to do for your male enhancement procedure.